The University of West Virginia suspending more than 24 students and shifting most classes to online only following a weekend of holiday parties. As many students from college age to kindergarten start classes in earnest following Labor Day, an alarming new report adds to the concern among top doctors about COVID cases among children. According to the American Academy of Pediatrics and the Children's Hospital Association, COVID cases among children shot up more than 17% between August 13th and 27th, with more than 70,000 new child cases in that time span across the U.S.
We know that there have been numerous outbreaks on those college campuses, leading to hundreds of cases on even individual campuses. So I think that this is really in the context of kids acting a little bit less safe, and as well as the college campuses and the K-12s opening.
Video obtained by CNN shows a large outdoor gathering at Penn State University recently, many students not wearing masks or distancing. It prompted a stern warning from the university's president, bluntly asking students, quote, "Do you want to be the person responsible for sending everyone home?"
Right now, the key to Penn State staying open is the behavior of every single one of us.
At Ohio State University, more than 200 students were recently suspended for breaking the school's COVID-19 rules on socializing. And NC State University recently announced it's reducing its on-campus housing population because of a rising number of coronavirus cases there. In Georgia, Mississippi, and Utah, thousands of students and hundreds of teachers have recently been asked to quarantine because of exposure to coronavirus. Experts say the increase in child cases could also be a result of more children being tested in recent months. The new report says despite the climbing numbers, severe illness from the virus is still rare among children.
The bad news is that when a child gets sick with COVID-19 and winds up in the hospital, 1 in 3 of those children needs the ICU because of how severely ill that they get with the disease, especially if they have a whole body inflammatory response where their immune system just really goes out of control and causes widespread illness.
Experts say even with this new information, there's still at least one crucial set of data that is unknown regarding children and the virus.
What we still don't understand is how much kids are a vector for this and how much they are the index case in a given household. So in fact, we don't know how much kids transmit this disease.
Charmed, no, relax, charmed.
Nobody likes getting a shot, but this year it's more important than ever. Because this year we're going to have not just flu, but also COVID-19.
I am worried. I do think the fall and the winter of 2020 and 2021 are going to be probably one of the most difficult times that we've experienced in American public health.
This year, there's not 1, not 2, but 3 reasons to get yourself a flu shot. Number 1, it'll decrease the chances that you'll get the flu, or if you do get the flu, you'll get a milder case. Number 2, you won't spread the flu to other people. Number 3, you won't end up taking up a hospital bed that someone else, like a COVID patient, would need. And if you get sick, getting the right diagnosis could be tough.
We won't be able to distinguish immediately between whether somebody has flu or whether somebody has COVID.
Flu vaccine manufacturers have ramped up production, making tens of millions more doses than last season. And there are 2 new flu vaccines designed to protect older people who are especially vulnerable to the virus.
So this child is Ryan. This is Ryan.
And for children, the Trump administration last month authorized pharmacists to administer the flu shot to children ages 3 and older. Hopefully, this upcoming flu season will end up being relatively tame. In the southern hemisphere, where flu season is now ending, they've had a pretty easy season.
Many of the physical distancing and public health and social measures that have been put in place, which keeps people apart, may have actually played a role in reducing circulation of influenza.
Even if that happens in the northern hemisphere, though, it's still a good idea to get a flu shot to keep you and those around you as healthy as possible.
How can I safely get a flu vaccine in the middle of this pandemic? A very fair question. People want to maintain physical distance. How do you still get a flu shot? Well, luckily, many places around the country are offering drive-through flu shots. And if you go to your local drugstore, some of them even offer the flu shots within the drugstore while maintaining safety protocols. I understand the desire for social distance, but I think it's also important to get a flu shot this year. It's important to get one every year, but perhaps even more important this year because we're probably going to have a convergence of both flu and coronavirus this fall, so anything we can do to reduce flu, I think is going to be really important. Will the flu vaccine protect me from coronavirus as well? Unfortunately, no. These are both considered respiratory viruses, and many of the symptoms can be very similar, a cough, a fever, sore throat, but unfortunately, the flu shot does not protect you against the coronavirus. Can I get coronavirus and influenza at the same time? The answer to this question appears to be yes. There have been a few studies on this now. One large study actually looked at patients who with known coronavirus and also examined their respiratory specimens to see if they had another respiratory virus, and 25% of the time, roughly, they did. This is yet another reason to make sure you get your flu vaccine this year. What can I do to prevent getting the flu this year besides getting a flu vaccine? Many of the same things we've been talking about for preventing coronavirus work to help prevent the flu. In fact, because of some of these measures that have gone into place over the last few months, we have seen places where flu has also decreased. Obviously, with coronavirus, you wear a mask, you try and keep physical distance, you're washing your hands as much as possible. You're doing all the things to basically make it harder for this virus to jump from person to person. The same things that work for coronavirus are also going to help decrease the chances that you'll get the flu.
It could be a dangerous combination, COVID and the flu.
The concern at this point is that having two infections in the same person could cause potentially significant injury to their lungs.
In an updated policy statement, the American Academy of Pediatrics recommends children 6 months or older who are medically able should be vaccinated against the flu by the end of October.
It's not an immediate protection. The sooner the vaccine is given, the more likely it is that by the time that flu starts circulating, you'll be protected.
Dr. Flor Munoz, lead author of the recommendation, says flu-fighting antibodies will wane by getting the vaccine early, but she says you'll also be protected early and says this will carry you through the flu season, which typically peaks between December and February, but could start as early as October. Munoz says based on previous seasons, children will play a pivotal role in spreading the flu. And early vaccination is also important because of the many COVID question marks.
This virus will potentially stay and cause outbreaks in different places that might make it difficult to have access to care and have access to their flu vaccine.
For Health Minute, I'm Mandy Gaither.